So you should be encouraging, as you do, I'm sure, with have them take care of themselves, because they have to have a sense of, they have a sense of pride, and they want to know I can take care of my own self. But you have to make sure that they're doing the right thing, and you can help them if not. We'll talk about tooth care in a bit. So be observant for signs or problems. Remember I said, ill-fitting dentures, infections, loose teeth. You're the person who's there more than, again, maybe more than other people in their lives. Have the appropriate tools, and I'll show you some of those things to take care. And monitor how they do it. If they're brushing their teeth, are they doing a good job? And maybe most importantly, communicate progress and problems to family members, because again, you're the ones who have to let them know this. So let's talking about changes in cognition or dementia. This is something you're dealing with all the time, and it's usually a continuum, because someone will start out being fine, and then over some period of time, sometimes it's slow, sometimes it's rapid, they are not able to take care of themselves as they used to. Again, this is where you're the eyes, because you're there all the time, and you know that they used to be able to do this, and now they can't do that. So you have to let people know what you see. So here, in terms of oral care, here's some tips. One is that just provide short, simple instructions. Just as you do, like you wouldn't tell somebody who has some advanced dementia, okay, now put on your clothes. You'd say, okay, here's your shirt. Now we're going to button your shirt. We're going to, you break it into segments, because their minds often can't contain a lot of complex information. So it's, okay, here's your toothbrush, we're putting toothpaste on it, we're putting it in your mouth. You're breaking it up into something that's easy to understand, and it won't confuse them. You could also use a watch me technique. You could say, see what I'm doing, and now you do it, So that'll remind them what can be done. And again, you should encourage them to do it themselves if possible, and you should monitor them as they're doing it to make sure they're doing the right job. Some other things to remember is avoid baby talk, but speak in a calm tone. So these are adults, they're not little children, so of course we should be respectful. And the other thing to consider is that, as we get older, we lose our ability to hear voices in a higher register. So if you are talking to them, okay, how you doing? If you're in a high tone, thinking you're being kind of kind to them, they may not be able to hear you. So, speak in a normal or maybe even a lower register to tell them what they should be doing. Move slowly when approaching a patient's face. As I'm sure you're experiencing, sometimes people get a little paranoid or fearful when they get older. So you want to, move slowly towards them, especially their face, because their eyes, their mouth is there. It's a sensitive area. It's best to do oral hygiene after the last meal. So basically have them go to sleep if you're there with a healthy mouth. You can use a mirror to show them what to do. Approach the patient in front, at or below eye level. So instead of kind of looming over them, it's good if you could look at them in their eye on the same level. They'll feel more comfortable. And have all the materials you need ready there. And smile and be friendly. This is important. It's as basic as that seems. As people lose their ability to understand what's going on around them, they may not know who their son or daughter is. They may not remember you. But if one of the last things to go is their emotions, and if they see you smiling towards them, their body will say, this is a friend, this is not a threat to me. If the patient can self-care, monitor them. If you encounter resistance, you may need to do oral hygiene in a few sessions. So I know this can be very difficult because you're going in someone's mouth, but it needs to be done. Now you are taking care of people's bodily needs on many levels, and I'm sure you have to be creative. And how one person you can do one thing with, another person you have to create another method of approaching them. Well, the same thing with their oral care. This works for this person, this doesn't work for the other person. So, find out what works with that person and use that. Give the patient something to hold on to. So sometimes people, if you give them a stuffed animal or a towel or something when you're doing it, it makes them feel a little more comfortable. So why do we brush our teeth? Well, we don't want to have bad breath. You get food off there. But the other thing is, I told you that there's good bacteria and bad bacteria. You are always going to have bacteria in your mouth, some kind of plaque in your mouth. As soon as you brush your teeth, some is still on there, and it's going to stay on there. But what you're doing is you're controlling the amount of bacteria on to keep it below a level. So the way I'd liken it is, let's say you don't take a shower for 3 weeks. What's going to happen? Well, first you're going to lose all your friends, right? But the other thing is you're going to get some skin rashes and stuff like that. And the reason is that it's normal to have bacteria on your skin, but if you don't take it off periodically, it's going to start, bad bacteria start growing on there, and you're going to get a skin infection. Well, the same thing in your mouth. If you don't remove the extra bacteria that are there, you're going to have overgrowth. And I told you that term, dysbiosis. You're going to go from a healthy mouth with healthy bacteria to an unhealthy mouth with unhealthy bacteria. So how do you brush your teeth? First, let me say, from my practice, when I ask people how they brush their teeth, many people kind of knew it, but I suspect that most people brush their teeth by putting on the toothbrush and going no, and spitting, right? And so the problem with that is that you need more time to brush your teeth, and you have to be methodical about it. Again, going back to taking a shower, if you go in the shower and you put some soap over here, some soap over there, and soap over there, but not the rest of your body, you're missing a lot of your body, right? Well, your mouth is a complicated place. Your teeth, they have all these little bumps in the teeth, so they have an inside and outside. So the way to make sure you do a good job is by doing it methodically, doing it according to a pattern. So this is one way of doing it here, which is quite good. And by the way, you should be using a soft toothbrush. A hard toothbrush is not such a good idea because it'll actually wear your teeth out. And you don't need a hard toothbrush to take off plaque. But you go back and forth across the person's mouth, across your mouth, and to the other side. And then you're doing the inside, and then do the bottom, back and forth. So by doing that, and it sounds easy, but if you actually take the time to do it, it's going to take certainly over a minute to do it. When you're doing it on your client, and we'll talk about it later, you have to use the same kind of pattern. And I hope that you do this, for your own mouth. So same thing goes for the bottom teeth. So what you should do is, instead of just saying, okay, Mr. Jones, it's time for you to brush your teeth, you should say, okay, Mr. Jones, it's time for you to brush your teeth. And as he's brushing his teeth, maybe kind of watch how he's brushing his teeth. And so I give you permission to blame it on me. You could say, I went to this lecture the other day, and this doctor told me that, you need to do it in a pattern, so I think maybe why don't you try this? So what you're doing is you're educating your client. And I think you probably do that all the time, don't you? Don't you show people how to do things, right? So this is just changing that same pattern of how to take care of someone's body, but applying it to their mouths. And then give them some positive reinforcement, like good job. So here's two other situations. So these people can't really get up and use the bathroom. So what is this over here called? It's a Mrs. Pan, right? Yeah. So what you're doing is but this guy, he's able to brush his teeth. You're watching him brush your teeth. You're wearing gloves, so let him do it because he can do it. Yeah. So this woman over here has some cognitive problems, some dementia. She really can't brush her teeth, so you have to brush her teeth for her. And let me stop and say one thing is that you all have a very difficult job, okay? And I think most people don't appreciate that because you're taking people who are vulnerable, they're at their most vulnerable, they're unhealthy. Sometimes they don't want you to help them, But as professionals, you have to be creative and figure out a way to do what needs to be done. So we'll talk about that. So here's a case where this woman is not able, so this person, wearing gloves, is brushing the teeth for her, using that same technique. Don't use too much toothpaste. So here's another situation, is both these women are not able to brush their own teeth, but they might have some trouble keeping their mouths open, but there are things you can do. In this case, you're brushing the teeth with one hand, and you're using the back of another toothbrush to keep the teeth apart, so you can get in there and do your job. And there's actually for sale, you can get them from drugstores or online. There are mouth props. So in this case, that's using to keep their mouth open so you can do what needs to be done.